Seborrhoeic dermatitis is our fancy word for dandruff.
Okay.
And we think of dandruff primarily on the scalp, but seborrhoeic dermatitis or dandruff can actually occur in other places as well. It can occur on the eyebrows, around the nose, for men, in beards, and central portion of the chest. And many times it can just go away simply with a dandruff shampoo. Sometimes it requires something a little bit stronger. Seborrhoeic dermatitis and dry skin, and in some cases psoriasis, actually have overlap in appearance, and they can look very similar. It's sometimes difficult to separate them, and so we have to examine you closely and treat you appropriately. Outside of infancy, children don't tend to get seborrhoeic dermatitis. Seborrhoeic dermatitis is more common on oily skin, and so it does tend to present 20s and later in life. So we don't see a lot of seborrhoeic dermatitis in children. Psoriasis also doesn't tend to present very often in children. We see that more in two groups in their 20s and in their 50s. So it has what's called a bimodal distribution, but we don't tend to see that very young as well. On the other hand, eczema can be seen at any age. Some children, even as babies, have very severe eczema, and I see eczema in even very old adults.